Greetings. My name is Janis Davis Street, and I am the Manager for Global Public Health and Special Projects at Chevron. Chevron is proud to be a partner with GBCHealth and CAMA. Together, we believe that multiple entities, including governments, NGOs, civil society, our scientific communities, and the private sector, have a role and responsibility to advance public health disease prevention initiatives, health security, and community prosperity. What we've heard today reminds us that mosquitoes don't take a hiatus, and neither can our efforts to intentionally and deliberately address mosquito-borne diseases. The End Malaria Project's goals and activities align well with our workforce prevention programs. And at Chevron, we know that the health of our workforce is inextricably linked to that of communities where we operate and where our employees call home, in Nigeria and in other high-risk regions. By working together, engaging all levels of stakeholders, and aligning around our common goals, we can deliver significant impact in reducing malaria's burden. I challenge each of us to take one action within our organizations, our communities, our schools, and our neighborhoods. This may be supporting education, research, or training initiatives. It could be funding, it could be building awareness. These all are different ways that we can together help to end malaria and build healthier and more productive communities. Thank you.
Hi, my name is Omobolanle Victor-Laniyan, and I head sustainability at Access Bank. Undoubtedly, we're all aware, and based on all the conversations that have happened today, that malaria is one of the most important public health issues worldwide. It's the leading cause of mortality in many developing countries, and year 2019, we saw about 409 deaths from malaria alone. Malaria also imposes substantial costs to both individuals and governments, cost to their families, cost of purchasing drugs and treating malaria, cost of travel to hospitals, loss of days at work, and overall, the direct cost of malaria is estimated to be about 12 billion US dollars on an annual basis. Also, the ongoing COVID-19 pandemic has placed an extra burden on global health and on Africa's health systems. We have many countries, particularly in sub-Saharan Africa, that account for more than 90% of global malaria cases and deaths, and they're facing a double challenge of protecting their citizens against existing threats to public health like malaria and emerging issues like COVID-19. So malaria intervention programs have truly been affected by COVID-19. For the prevention of malaria, for instance, insecticide-treated nets need regular renewal, but distribution campaigns have been delayed or canceled in some communities. For detection and treatment of malaria, some individuals have stopped visiting health facilities out of fear of exposure to COVID-19. Also, supplies of drugs have been interrupted, and this has compounded the production of substandard and falsified medicines and diagnostics. So there is really an urgent need for all of us to join hands together to work on malaria prevention and control. And the private sector indeed plays a very critical role. We cannot deliver on economic progress without a healthy people. Businesses of all shapes and sizes need to collaborate, and we need to use our resources and position to help millions of people across Africa. With this, the fight to ensure malaria elimination across Africa will be won significantly with a more coordinated and results-driven elimination response. This, therefore, has resulted in the birth and the launch today of the End Malaria Project. This project is designed in line with the World Health Organization's key community program elements, such as awareness and public education, vector control, early diagnosis, and effective treatment. As such, the End Malaria Project will pilot starting in Nigeria and is set to increase awareness level and improve health-seeking behavior of community members. Is also set to reduce malaria transmission through indoor residual spraying in selected local government areas. Is set to ensure the distribution of about 150,000 long-lasting insecticide treated nets across the country in this pilot phase, and also to carry out effective malaria diagnosis through rapid diagnostic testing of over 80% of the residents in select project states. So the states to be piloted are Kano, Niger, Gombe, Lagos, Ondo, Akwa Ibom, and Ebonyi states. And we expect that at the end of this pilot, we would have improved knowledge, attitude, and practice towards malaria prevention and elimination for citizens, especially in local communities, particularly pregnant women and families with children under 5. We believe we will be able to reach 1 million Nigerians with malaria prevention messages, and over 500 health workers and implementers will be able to improve their ability to respond to malaria through the capacity building sessions. So we call on you to join us so that together we can eliminate malaria. Thank you.
Hello. Good day all. My name is Dr. Perpetua Uhomoibhi. I'm the National Coordinator of the National Malaria Elimination Program, Nigeria. As the National Coordinator, I'm pleased to be part of this momentous occasion of the launch of the End Malaria campaign in Nigeria. I have noted which is a private sector-driven approach to contribute to Africa's quest to eliminating malaria from our continent. I've noted that the goal is to strengthen multi-sectoral partnership towards attaining zero malaria in Africa over the next 3 years, and this put the continent on a sustainable path for achieving the goal of the World Health Organization Global Technical Strategy. I have noted that the strategy being adopted is the system strengthening, workplace and community building, advocacy and communication, and partnership. These interventions which are going to be implemented in the pilot phase rightly outline with and will contribute significantly to the objectives of the new Nigeria Malaria Strategic Plan 2021 to 2025, which includes, among others, improving access and utilization of vector control interventions in at least 80% of targeted population by 2025, improving access and ensuring provision of chemo prevention, diagnosis, and treatment for 80% of the population at risk by 2025, improve generation of evidence for decision-making and impact through reporting of quality malaria data and information from at least 80% of health facilities, both public and private, and other data sources, including surveillance, surveys, and operations research by 2025. It also includes strengthening coordination, collaboration, and strategic partnership to promote efficiency and effectiveness towards OCAS too. Lastly, we also plan to improve funding for malaria control by at least 25% annually through predictable and innovative sources to ensure sustainability at both federal and state level. We believe that the attainment of this objective required a multi-sectoral, multi-strategy, and collaborative approach in order for the country to achieve our targets of a parasite prevalence of less than 10% and reduction in mortality attributable to malaria to less than 50%, 50 deaths per 1,000 live births by 2025. Let me stress also that meeting the goals set out in the WHO Global Technical Strategy for 2020, from 2030 and achieving malaria elimination requires a similar approach, including strengthening cross-border collaboration in Africa. It is therefore important for each sector player to reinvigorate its contribution to the fight against malaria, which resonates well with the current theme for this year's World Malaria Day, which is Zero Malaria, Draw the Line Against Malaria. And for us in Nigeria, the slogan we have chosen for this year is Stand Up and Take Action. I believe that with this collective approach, we will be able to achieve our targets in the next 5 years towards a zero-free malaria in Nigeria and Africa as a whole. Thank you.
So, good afternoon, everybody. We've come to the end of today. My name is Zouera Youssoufou. I am the Managing Director and CEO of the Aliko Dangote Foundation here in Nigeria. And my principal, Aliko Dangote, whose foundation I run, is our malaria ambassador for Nigeria. And in that role, how he sees it is how can he use his organization to lead by example, which is why we have company-led programs against malaria that are actually delivered in partnership with GBCHealth. So that's one of the benefits of our membership and support with the organization. And also, he's part of the End Malaria Council, which brings together Bill Gates and Ray Chambers and a few other African and global leaders to discuss how to finance the gap to finish with malaria forever. So thank you to all of our panelists today for their useful insights. We really hope that this event has provided some lessons and some opportunities on how to really work together and fight to end malaria, especially during this COVID pandemic, which obviously has put a strain on all of our different systems. So we thank everybody for your commitment to the End Malaria Project, which was launched today, and look forward to working with all of you towards ending malaria. Thank you very much. And I believe this brings us to the end of our event.